start our COVID-19 update. We'll talk about case numbers. Itasca County has seen 6,326 cumulative cases. Past 7 days, 188 new cases. Past 14, 415. 14-day case rate is sitting at 91, and that actually is of 10/23. I believe I have a typo on that for your copy. That's down from 97 2 weeks ago, although we're still incredibly high with our cases. We've been hanging in the 90s range for about 3 weeks now. A little sadder news, we've had 87 deaths, and 16 of those have been in the last 6 weeks, just since September 12th. This is one of our hardest hit time periods throughout this pandemic for deaths and hospitalizations and ICU stays. Average age of positive cases in the past 2 weeks is 38. 24% of our positive cases are in 18 and under. We have seen some of our vaccination numbers go up a little bit, which we're very excited to see. Our 12 and older population is up to 62.6% beginning their series. 16 and over, 63.8%. Our 65 and older went up to 89.5%. If you follow it really closely, you can see the numbers go up and down and up and down. And I believe I said this 2 weeks ago, it's not that people are getting unvaccinated, it's just that they're moving or maybe leaving our area for the summer, going somewhere else for the winter. And when the database changes, it gets cleaned up. So it can fluctuate a little. And if people move into our county and they're unvaccinated, that would fluctuate as well. Total population receiving 1 dose, this is regardless of your age, 54%. Our public health staff have offered 7,159 COVID vaccines. We actually gave 5 more than that today. We had another vial that we gave of Johnson & Johnson. Future clinics, we were offering Johnson & Johnson weekly through October. Our final clinic was today. Once our influenza clinics are finished and we complete a series of Moderna booster vaccines, we'll revisit the Johnson & Johnson again, just based on time and staff and space and all of those things. We really need to be thoughtful about that. We are offering booster doses of Moderna on November 15th. Between 10 and 2:30, and November 18th between 1 and 5:30. These will both be at the Itasca Resource Center. Registration links are not quite on the website, but they will be, and if you called us, we would give them to you. We just want some language to be cleaned up by the vendor for that particular website. And of course, we'll still do homebounds, whether it be influenza or COVID vaccines. One more thing on boosters, although I do believe I have it lower on the agenda. We're working with the Interact students again from Grand Rapids High School. We're going to have them make some calls specifically to the populations that struggled with the online registration and using technology to find out about vaccines. We're going to have them we're going to pull who those people are, have them actually make the calls and get the registration done for them. So probably focusing on our 65 and older population first. Because other folks, if they have a valid email, we can send information that way. Boosters are available already, actually. If you don't want to wait until November, pharmacies and clinics, they're already offering. Influenza clinics are underway, primarily schools and work sites this week, last week, this week, next. We do have a public clinic on November 4th from 2 to 6 p.m. at the Itasca Resource Center. We will take walk-ins. That's anyone 6 months of age and up. So for boosters, Pfizer, Moderna, those folks who had received those vaccines and are 6 months out from their primary series of 2 may receive their boosters. The focus is persons 65 years and older, anyone 18 who lives in a long-term care or congregate setting of some sort, anyone 18 and older who have an underlying medical condition, and then anyone 18 and up who work or live in a high-risk setting. Public facing, maybe are surrounded by folks with COVID or just aren't able to distance. Johnson & Johnson boosters are recommended for anyone 18 and older. It doesn't necessarily matter about your health status or your work setting. What you can do is you can receive any of the other vaccines or a Johnson & Johnson for your booster. You have that ability to decide which one you'd like or what's most available. Again, we're not going to offer more Johnson & Johnson boosters for a period of time. We will revisit it. It's just not going to be soon. So we'd encourage someone to get in and do your Moderna or Pfizer for your second dose if you're 2 months out from your first. I have the places that different vaccines are available: Pfizer, Scenic Rivers, Essentia, Grand Itasca, Walmart, and Thrifty White. Both of those are by appointment. Moderna has a little more ability for walk-ins. Thrifty White, Walmart, Walgreens, CVS, and Scenic Rivers. And then again, we'll offer soon as well. Variants, Delta remains the active variant. Vaccines do remain effective against the variants. There hasn't been a variant yet, although there are some coming that there's concern about. Variants are still highly affected by the vaccination, so that's the number one thing you can do to prevent the severe illness and death. Schools, we're working with all the districts weekly, sending them data both at the county level and the district level, and they're using that to inform their decisions as well as what's happening in their buildings. Can they staff it? Do they have staff out sick? How many kids are out either with COVID or just other influenza-like illnesses? We have RSV, we have strep, we have other viruses circulating in addition to COVID. So sometimes a classroom is down kids, and it's not solely due to COVID. There's just a lot going on right now and earlier than normal. Usually we see this in the winter, and we're seeing it a lot earlier this year. Vaccine breakthrough was a hot topic. 2% of our fully vaccinated residents have tested positive for COVID. This is updated once by the Department of Health late in the week. We do receive plenty of requests to update this more frequently, that current people that have COVID, were they vaccinated? And we just don't have that ability to have it available in real time. It has to be a week or longer. So I just want to keep reminding folks we can only provide what data we have available to us, and there's always some scrubbing of data that happens. So we do our best to keep people informed, but it's still really small. So 529 people out of 23,424 have tested positive for COVID. Of those 529, 35 were hospitalized, 6 in the ICU, and 7 have died. Of those 7 who died from, and this is a COVID death. It's been ruled a COVID death. 1 person in their 90s, 2 in their 80s, and 3 in their 70s. Masks are still recommended in public indoor spaces. There's a lot of COVID in our county. It's been fluctuating up and down for weeks. We haven't really seen a strong showing that we've peaked yet, so we still need to be safe. Use our masking and social distancing as well as vaccinations. We'll continue with our weekly media releases going forward, and then press briefings are going to be as needed. Our plan is to do 2 in November. We did not do 1 in October, and those are in the works right now. And then we have our COVID information line. We want the public to know this is a message line and it's checked regularly. We don't have a live body, but you will receive a return call quickly during business hours. And that's 218-327-6784.